Dr. Shelley, Cheyne, chiropractor. Thank you so much for having a chat with me today. We're talking about a topic that we're both very passionate about, but I understand it very much from a physiotherapy point of view, and you understand it and how it's integrating into your chiropractic clinic and with your clients. So it's fascinating to have a chat with you today, and yeah, so thank you. Welcome.
Thank you.
Can you give us a bit of a rundown on your history as a chiropractor, your training, and how chiropractic came about for you?
Okay, thank you for having me, first of all.
Pleasure.
I am a third generation chiropractor and practice in Porirua. I studied in California at Palmer College of Chiropractic West and have been practicing now in New Zealand for close to 29 years. So I work in a family practice with my father, but also my grandfather and uncle and brother are also chiropractors.
Family affair.
So it's pretty much just a family affair.
Yeah, awesome. Yeah. So 2 years ago, we had a conversation about pelvic power and how I explained to you how it was working for my patients. And I had a strong suspicion that it would work well for yours. And that was a really great conversation. Tell us about how that's panned out now that you have used it now for over 2 years. Over 2 years, yeah.
Yeah.
So how's it going?
So I've heard about pelvic power several years ago from patients who came into the clinic, because I've always been interested in the pelvic floor and how the core muscles support the spine from a chiropractic perspective. And so when you phoned me a couple of years ago, I thought you were talking to me to explain it, about what it's all about, not realising there'd be an opportunity for our clinic. And at the time, I looked at it as, with it being COVID, that it was a way to have a diversification of business in our office, because we didn't know in 2022 what we'd be able to do chiropractically to be able to work. And so when you phoned and told me about it, we did it, first of all, thinking it would be something as a diversification. But the more I learnt about pelvic power, I realised that it totally complements chiropractic care. Chiropractors want to get the spine and the brain communicating on the same page and get the body functioning the best it can, and we can deliver chiropractic adjustments that help people to function to a high level physiologically. However, if they don't have pelvic floor strength, it turns out their spines don't work as well. So at first I thought it was a diversification, and that would be a way that we could integrate that into our business. But I've realised, because our clinic's been there for over 55 years, I think it is now, I realised that all our patients, our mission statement is to get people functioning and taking responsibility for their health.
Yeah.
And so by learning to use their pelvic floor and what that works, which is what pelvic power shows people, it was a way to help people function to a high level and work better. So it was so much more, Nathan, than what I thought it would be, because it's amazing. Pelvic power is amazing because it's a way for people to feel where the pelvic floor is. But one thing that's so important, which is what really hooked me in when we spoke, is that not only does it strengthen the muscle, but it also relaxes the muscle and tones down the muscle. And for myself personally, I always thought you had to strengthen your core, but didn't realise that there were several phases of pelvic floor. The way it needs to work, it has to be able to contract and relax quickly and slowly, but also it has to be able to hold a contraction, but also hold a relaxation. And the pelvic power chair teaches and enables the body to do that.
Yeah.
So from our perspective, it gets patients stronger so they can hold their adjustments better. Because if people keep putting their back out, then that's kind of the standard joke for chiropractors. You know, you go once, you have to go again and again. Then if they can hold their adjustments, not only do they feel better, but their brain and their body are communicating.
Yeah.
And that's, in basic healthcare, that's what we want.
I didn't used to account for how important the mechanism of the neural circuitry and cortical representation being a big part of people's core and pelvic floor function. And now we see changes very early in their rehabilitation process that we'd normally see a bit later on through much self-effort kind of scenario. This ability to know where the pelvic floor is. They come back typically. Do you find that? They come back typically and say, I've been much more aware of my pelvic floor.
Yep, absolutely.
And sort of connections that we want to see happen very early on, which is normally a breakthrough some weeks down the track, sometimes with our self-training sort of instruction. So do you think that's a big part of what's happening with your chiropractic care? So what you're saying is you can do a really good adjustment and basically that corrects the communication through the this is more your language.
Yes.
But that holds better.
Yes.
Because there's better stability in the system. Yeah.
So at our clinic we use muscle testing as a tool to be able to determine if people are working properly. So I can work through patients, adjust patients, offer nutritional advice, like look at basic exercises, different things, and that can help people's body function to a high level. And 9 times out of 10 they hold their adjustments and it works better. Every now and again you get people and they go, well, I went to the gym and I exercised as you told me to. I say, put a load on, let's work it a bit harder, and I'm sore again. I've re-injured myself. Right. or they're the type of people that they trip and they put their back out and they're doing something that shouldn't put their back out. The body is strong. There's 86 billion brain cells that govern the whole body of 70 trillion cells in the body. So the body is designed to run. So if you trip over a piece of paper, you shouldn't put your back out.
Yeah, should be a bit more resilient.
Exactly.
That, right?
And if you are, your body is not functioning properly. Therefore, those are the people that can really benefit from a chiropractic perspective from Pelvic Power. But then what I find is once you then start talking to people and explore their history a bit further, which I'm now doing since we have the Pelvic Power at work, I realise that when I ask, what's your bladder control like? Do you have bladder weakness? Have you had a history of painful periods? Have you had, different things like this? Often there is a history going on there and it's always been there. And so therefore they've always had a weak pelvic floor, and weak being the muscles aren't working or they're overworking.
Yeah.
And
which would both cause weakness.
Which is both called weakness, which was that was one of my 2022 ones of learning. And so then by addressing that with the Pelvic Power system, like you said, it creates an awareness and people now know where their pelvic floor muscles are and they can use them better.
And what state they're in.
And they function better. And like you said, it takes their not really, then click. Yeah. And it clicks and it works better and their quality of life's better. But what's really interesting to me, Nathan, is it was 2022, so that was the COVID era when we learnt about Pelvic Power, and chiropractically I'd found a lot of people post-COVID, their breathing wasn't as good, they've had lung issues, and the pelvic floor works directly with the diaphragm. And the diaphragm controls your breathing, helps with breathing, which helps the brain to function.
Yeah.
So therefore...
And the state of the autonomic nervous system.
And the state of the nervous system, all the rest of it. So therefore, if one bit's not right, and is one causing one or one causing the other, I'm not sure, but by teaching people how to breathe, teaching them how to use their pelvic floor, the two work together, and then people can hold their bodies, their function, and they feel better.
Yeah. Do you think it has a change on effect on their posture?
Oh, 100%.
Amazing, eh?
100%.
Yeah.
And then now I've learned that there is a very, very specific, in a leaner framed person where they sink into their body and they appear a bit almost hump-like in their back, and in a bigger frame person, they just sink, and it's almost like their neck disappears into their shoulders, and they're bigger through their tummy and bigger through their back. And if they're in that position, you can just about bet money they've got a pelvic floor weakness.
Yeah. What happens what do you notice after somebody's done a session of
immediately,
functional magnetic stimulation?
Immediately once people sit on the chair, because the Pelvic Power chair stimulates the pelvic floor 25,000 times, which effectively is 25.
That's a lot of information going up to the cortex, isn't it?
It's about, I did rough math. I don't know if you've done rough math, but rough math, if you were contracting and relaxing your pelvic floor as a turn every 5 seconds, that's approximately about 34 hours of pelvic floor strengthening in a single session.
Let's face it, impossible.
You can't do that.
It's quite a different mechanism to get your head around, but the point is it's this really good sensory information coming up.
And so many people do their exercise and they're diligent and they do their Pilates and they do their yoga and they're actually doing a really good job. But I think you have to probably exercise the muscle 300,000 to 500,000 times to get it up to speed.
Yeah.
Could that be right?
I think it only needs to be strong enough to be functional enough.
Yeah.
It doesn't need to be like Hercules, but economy of recruitment is important, which is why being aware of the pelvic floor and its resting tone to be nice and that kind of scenario And to be coordinated and have endurance is key. I just think pelvic power functional magnetic stimulation is a really good adjunctive tool to help achieve that level. Do you find that, say somebody's done quite a commitment to Pilates, yoga, some other form of core stability training, and they're at a level, do you find that it takes them to another level?
Yes,
Yeah,
very much so.
That's what we find.
Or a lot of people have been going and feel like they're doing it quite well, but actually they're not using their muscles properly. Their breathing is out of balance.
Yeah.
You know, they've got a disconnect happening. And so it's teaching people how to get it right. Then they're really powerful.
Yeah.
And they're really strong.
Yeah, which may take quite a commitment and a bit more time to correct those motor patterns.
Yes.
Through supervised training, which is
very much so.
a thing, and I support, but it's a really great adjunctive tool just to get them there quickly.
Yeah.
I always say it's easier to maintain a good level of function than to try and attain it. And sure, it can be attained, but as soon as you've attained it, it's a lot more rewarding to just maintain it.
And then people, and I always say to people, once they've reached a level of strength, their muscle's pretty much working and it runs and it can do what it needs to do, but you need to keep on it. Kind of like myself as a runner. I can run, but I don't necessarily run to a really high standard. You know, but
not built for it either.
But so the same with your pelvic floor. Your pelvic floor is working, your brain knows it's there, so it's working. But to maintain it, it's better if you then do your extra core stability training.
Yeah, great.
You'll just become better again.
So I'm intrigued how you apply on the day-to-day these tools, pelvic power magnetic stimulation, into your with your patients and
Into chiropractic.
What does it look like? You see a client you've either seen for a long time or are seeing for the first time. Where does pelvic power fit in? What's the...
So every new patient that comes into our clinic, no matter what their history is and no matter what their age is, I test their pelvic floor. And that would be on a biofeedback trainer, which is available in some cases. And then I show people what it looks like and feels like to use your pelvic floor. And then I have a benchmark in my head of where those people are. So then as I continue with their care, I expect the person to improve and function pretty good. And if they find that they're not as good as they could be, then we look into pelvic power further. And then there's some people that are just not good, or they in their history that's apparent. And then I offer them at our clinic, we do a trial, and then we show them the whole package of pelvic power. So first of all, I'm just getting information on how their pelvic floor works, and then the other people I do a trial. And so our clinic, like I mentioned, it's been there for quite some time. So we've had people through the years that either have the posture pattern that is indicative of a weaker pelvic floor, or they've mentioned in passing they have weakness of their bladder control or whatever, or I know they've had difficult deliveries when they had babies, or I know they've had twins. In any of those people, I say, we need to do a trial. And then I test them, and I say mostly for them that it is for information. So I've used pelvic power a lot for information for people to learn how to use the muscles. And so then they learn that, but then for some people, they can tell that they need more, and then they're the people that then they can utilise the program more.
So basically, you know your client's history because you take it, and you're able to really quickly and easily get an objective assessment of their pelvic floor's function, which is non-invasive, and that helps you to marry up an objective finding to signs that there may be dysfunction.
Absolutely.
And that dysfunction can present in lots of different ways, can't it? And it can be bladder functions, how many times they have to get up at night to pee, or whether there's leaking, very obvious things, but it can be just that they lack spinal resilience because you know how little it takes for perhaps them to go into a more painful response to some physical activity or something like that.
Well, the classic presentations, which I'm really kind of targeting to check, just more as another point of view, so to speak, is people that have a vulnerable low back, and they always have a vulnerable low back, and they're a bit hesitant about leaning forward or brushing their teeth.
Guarded.
Or they're quite guarded. People with hip stiffness. That's often the posterior pelvic floor muscles aren't working so well. And also, like I mentioned, people that have middle back stiffness, and often that's the middle back or thoracic area, and the diaphragm is over facilitated because the pelvic floor is not right, because the pelvic floor and the diaphragm work together. So if the pelvic floor is over facilitated, the diaphragm's over facilitated, which will create a middle back pain. And so if people go, oh, my back hurts every time I'm peeling the potatoes, it hurts in my middle back, I know that their pelvic floor is not right. So then I can check them, and then I say, what's your pelvic floor like? And they say, oh, it's terrible. And I go, okay, let's have a look.
Yeah, and they can see it.
They can see it
straight away.
And it's important also, like you mentioned before, Nathan, that it's non-invasive. We can test the pelvic floor non-invasively. I'm not a trained pelvic floor physiotherapist, but I feel like I'm getting a fairly solid understanding of the pelvic floor function as a complement to the body function, which is the chiropractic care work that I deliver. But people can sit on a chair and they can have an idea of what their floor is like without it being more invasive testing.
Yeah, sure. I mean, believe me, we have people present to us who would prefer not to have, or actually specifically come to us because we've got non-invasive options. And there's pros and cons of all different tests that we can do. Obviously, some more invasive than others, and some being able to assess prolapse, for example, you would have to test directly. But when it comes to working out endurance and coordination with breathing patterns and that kind of thing, I think the non-invasive biofeedback trainer option is really, really valuable. And the vast majority of people would prefer to do something non-invasive first, and it gives a chance to build rapport before something more invasive has to be done anyway. And you can refer on for something that is more complex and needs that kind of assessment anyway. So you're working with a person and you have a strong feeling that from their presentation and their indications that they may benefit from Pelvic Power. So in a day-to-day practice managing your patients, how do you integrate them into trialling Pelvic Power?
So what I'd say, I do one of two things. Sometimes I directly say to them, I know that their back hasn't been stabilising as well as I'd like, and because their back isn't stabilising, I then ask them, do you have any bladder weakness, or what's your bladder control like? And see what their response is. And some people say, oh, actually it's not very good, and some people say it's fine.
Yeah, so they say it's fine, but I couldn't jump on a trampoline.
Yeah, there's something like that, exactly. And then
Unless I've got a cold.
And then I say, we've got an additional service here that I would like to do a trial on you, because I have a feeling that your back pain could be due to pelvic floor weakness. And that's when some people say, oh no, my bladder's totally fine. And I said, oh, that's fine. I just want to have a look. And so then we book a follow-up appointment for them for a trial, where I measure them on the biofeedback and I give them a trial on the Pelvic Power chair. And then I explain about what it works, what it costs, what it feels like, the safety features, what they should feel, and then I want them to see how they feel afterwards. Then from there, I write people a letter of invitation to explain everything we spoke about and to offer them, which they can or cannot take, it's totally fine, of what Pelvic Power has to offer. And then of those people, and I make it very, very clear that this is not just for them to do. And in that letter, I also give them options of what they could do to strengthen their pelvic floor on their own as well. So they know that I'm not just, I give them all the information. And then from there, people book in for an appointment, which I have an allocated time for the first session. And then when they sit on the chair, I explain how the chair works and how they can use it, and explain that I won't be there each time. Our staff will normally put them on the chair and they will just sit there and we'll go from there. And I book people in for blocks of 4 visits. So I do 3 on the Pelvic Power chair and I do 1 on the biofeedback as a reassessment, and I include an adjustment in that as well, which is something that our clinic does. That's not something that you need to do. That's just something that the way my approach to the body is, that's what I like to do.
So it's pretty easy to integrate into your existing clients' management.
Absolutely, so easy.
It doesn't detract from what you're doing, sort of like you're not making, you're losing in other areas from emphasis on other, you're already busy. You proved that basically, you can integrate it, you're extremely busy. I think you've got a 3-week waiting list, maybe more.
So no, it's about right now. It's about 2-ish.
Yeah.
We're steady. We're very fortunate there.
Yeah, but I guess the point I'm making is it's an adjunctive treatment that you can add into somebody's treatment option journey, and it wouldn't be hard to do even if you're really, really busy and don't feel like you've got enough time, because it's not exactly 100% supervised, is it?
It's not, not at all. We've at our clinic, we do have front desk staff, and so because of that, I can be seeing patients. Our pelvic power chair is effectively like an associate. So when people...
That you don't have to pay holiday pay.
Or lunch. Give them time for lunch. Yeah, exactly. So our staff, when people come in on their regular... So when I'm there for the first visit, and then after that they can come in at whatever time they want while our clinic is open. And our staff just take them down, put them on the chair, and for people that are regular, they kind of have shown them how to use the chair, and they can do it themselves.
Yes.
And so
very
they can
intuitive.
do it, which is very much so. And people like that.
Yeah.
And then I'm there for the reassessment to see how it is, which is in allocated times.
Sure.
And I was concerned, Nathan, first of all, how it would work. And when I went to your office the first time, it's so easy. And it's such. And when I went to your office that first time, that's when I realised it's an absolute complement to the care that we already deliver to our patients, and it just makes them get stronger. Because I've got a few people, which I'm sure you would too, where there's people that have sore backs, but actually exercise doesn't spark joy for them. And so they have they don't want to exercise, or they don't have time, or it's not in their priority system, and they're not going to exercise. But to have their back function, they need to exercise. And so the pelvic power is a perfect tool for those people, just to come in and they can do their exercise and fit it in and be on with their day. And it doesn't take any extra time at all.
No.
And they like that.
So essentially, in the beginning, you have to spend a little bit of time with your client the first time they're doing the chair, education and managing expectations about what it does and what to expect, and all that kind of scenario. But then the patient doesn't need that much supervision after a while. In fact, they don't really like being stood over to work out. They kind of enjoy just being able to zone out and work out. And then it's kind of they just like going in and doing it themselves. So it's less and less supervision required.
Yeah, absolutely.
Some set up by your staff who are there anyway when you're on holiday for your other associates. So what does happen when you go away and you've got pelvic power running?
Well, because we have people, and the way our clinic structures it is people that assign people to the pelvic power, we get paid a percentage of what the chair turns over for that particular person. And so therefore, if I'm away and if my people are booked in that week, then I'll still get that percentage because I signed that person up.
Yes.
And so therefore it means that, because a lot of chiropractors are contractors, so therefore if we've signed people up, then we can still be paid while we're not there.
Yeah. Which is nice, isn't it?
Which is nice, yeah.
A fee-for-service kind of clientele, whether you're a hairdresser or a chiropractor or a physiotherapist. If you're not working, you're not working.
No.
And it's kind of nice that pelvic power can keep ticking along when you're not there for some time. Yeah.
Yeah. And usually if it was for a lot, it would be for the time I was away. I don't tend to take really long holidays.
No, neither do I. I should take some more balance in life. In my journey, I've found PontMed, who make pelvic power, been extremely supportive. The reality is research is happening all the time, as it should, and we're finding out more and more about what frequencies of stimulation, for example, low frequencies for urgency or high frequencies for desensitization and hyperperfusion of tissue, and middle frequencies for better strengthening effect, and groups of frequencies to help with toning down the pelvic floor and improving resting tone. So as research has changed, pelvic power as a tool is updated regularly, which is fantastic because it just is in keeping with the current research. How have you found your journey with PontMed, Switzerland, who make pelvic power? Have you felt supported? Is there things that are available to help keep you on track with your evolving knowledge?
What I've found is that when we have our study groups, so PontMed every month does a review where Cleo does a review of a certain program that we have and explains why we use this program and what the current research is showing this year. So then we've been doing these meetings for just over a year now. And
every month.
And we started with one of the programs last year, and then we went back in a circle and we're back to that program again. But she updated us on the new research of how it works and the different programs.
And how they're adapting the programs to
And then
be
we
a
have
key
discussions, and it explains, and I've found from a chiropractic perspective is that now I'm getting a much better understanding of what the frequencies mean, because in the chair, as you know, there's the coil in the seat that stimulates the pelvic floor, and it changes. So each program for every condition has a different sequence of frequencies that are targeting the different parts of the pelvic floor, which is such a complex muscle. And so the more we have these sessions, I'm learning more about the chair and how it works and how much it can help people. And then from there, you can think about how to apply that to people and different people that I look after, and it might make a difference. And then in the end, we have conversations with people internationally, which I find just phenomenal. And sadly, you know, they're not a big group. It's just quite a small group at this point, but it should be utilised by more people. But just for the information for Cleo's presentation, it's absolutely fabulous.
So you certainly haven't been sold a piece of equipment and just left to it.
No.
Which is
It's
not ideal.
It's a beautiful piece of equipment. The technology is so good and it's so considered, and the research is so considered. And when you understand that it's about, and I don't even think that Pontment understands how good it is because it's targeting the pelvic floor, which it does beautifully, but what that impact of sensory stimulation to the brain can do and how it can help the body, and how much I'm learning. I've always used my chiropractic care, I always start with the pelvis usually, but how much the pelvic floor is such a key part of the pelvis and how much it can help people if it's working better, and how people just function better, and then how they breathe better, and then their spines work better, and then they feel better, and then they are more productive, and everything. You know, everything just works better all the time. So as a piece of equipment to complement chiropractic care, it's unbelievable. And a lot of people, chiropractors probably would have never thought of it like that because they look at it purely from just adjusting the spine. But my question to people is to ask yourself, when you're adjusting the person, you should do a great adjustment, and the body's designed to be resilient and to hold that adjustment. And if people aren't holding it, you've got to question, why are they not? And you, like I said before, you hope it's not something sinister, but chances are they just need to get stronger, and pelvic power is a tool
stronger
to do that.
and more connected.
Yes, absolutely.
So I find there's a common conception, even amongst clinicians in the medical fraternity, that think magnetic stimulation is just a kind of a lazy man or woman's way of strengthening the pelvic floor. Do you think there's more to it than that?
Well, it depends on where you are and what you're doing. For a lot of people that are highly, highly busy, they're working smarter, not harder.
It can be a lazy option, I'm saying, but it's actually got more benefits.
No.
And mechanisms than that.
What pelvic power is doing is it is using technology as a way to target the pelvic floor and get it up to speed and get it to where the brain is connected and know that the pelvic floor is there, so then it knows what to do with it. But when it's not working and the brain doesn't have that sensory information, it can't do it as effectively. And so it's a way to get people up to speed. People can do their own exercises, which will get them up to speed too, but it just takes a lot longer, and a lot of people don't have that diligence and discipline to do it. And they can do it, but they have to do it so many times to get up to speed. And the diligent ones, I have a lot of people that are like, nah, this is what I'm doing, and they do it, and they function really well. But on the most part, it's not lazy. It's working. It's using technology and the medical brilliance of some brains to target a muscle, get it working, to help people function better.
Now, undoubtedly there'd be chiropractors out there that think continence and sexual function is not something I'm professing or feeling particularly comfortable professing to deal with, which is fair enough. That may not be the emphasis of their clinic. So do you think there is validity in helping in the area of spinal resilience and back pain in itself?
First of all, it must be very clear that chiropractors don't cure or do anything like that.
Yeah.
What we do is we help support the nervous system and the function of the body to allow it to work better through chiropractic adjustments. And then from doing that and getting the body functioning better through chiropractic adjustments, which also can in turn improve sexual function
Yes.
and improve continence. So in our scope of practice, electromagnetic stimulation is a tool that we're allowed to use to support in New Zealand the function, to support our chiropractic practice.
Yep.
So therefore that would be something as a complement to business. And then people, if they're wanting to have those conversations, they can have those conversations.
Yeah.
But on the most part, we'd never say we're going to fix this, because we don't, the body does.
Yes.
And we're just there to support the system.
So it still fits nicely.
Yeah.
My point would be is that if you are helping somebody's coordination, endurance, connection with, and power
Yeah.
of their pelvic floor for their spine,
Yeah.
spinal resilience, you will inadvertently be helping their sexual function and continence and bladder function and how many times they have to get up to pee at night,
Yeah.
and all those things anyway. Is that fair?
It's a nice side effect.
It is. It's kind of, well, a bonus. So people may come to me because I profess to be a pelvic health physiotherapist, so I deal with sexual function and continence and bladder behaviour, and I come at it from that angle. But they're coming to you for often pain and spinal resilience and your wellness assessments and a journey of keeping them well using chiropractic care. And so they'll be coming to you from that angle. But at the end of the day, they're kind of meeting in the middle as their pelvic floor, which is involved in spinal resilience, erectile function, orgasm intensity in women, and all of the researched, irrefutable roles of the pelvic floor are being addressed, really. And whatever somebody's motivation is, they come to me with those motivations of continence and sexual function. They may come to you with different motivations, but at the end of the day, we're helping them in all of them.
Yeah, so what's the question?
I'm just making that statement. It's kind of the wonderful thing about pelvic floors. They have multiple functions, so multiple benefits of being optimised.
Well, because they allow for excretion, the
Yes.
pelvic floor.
They need to relax and release.
Relax and release. They support the organs.
Yep, with nice resting time.
Yep, and they also complement with the diaphragm, right? So they're working that and
So
all those things
core
together.
stability.
Core stability. So all of those things work together. So from a chiropractic perspective, if we're wanting to get the nervous system functioning,
Yeah.
that will happen. But we're wanting to make sure, that's why I said in the start, we've got to get that brain-body connection first.
Yes.
And if I know, and I can tell because the way I'm approaching, which is very exciting, the body, if I know the brain and the body are on the same page, I know that I've delivered the adjustments, I know things should be working properly, and if they're not, then I know they're not strong enough.
Yeah.
And that's the next line of attack, because if you don't use it, you lose it. You know,
Yeah.
you've got to keep people working. So it's just trying to get all those things working together.
Yeah.
But things people do, because we were, the United States a few years ago, a lot of chiropractors were saying, oh, we can help this and we can help this and we can help this. A lot of the things you spoke about before, and we were kind of given a very firm slap to the hand. No, we don't help. We get the body functioning,
Yes.
and that would be
So
like
that
what
can
you've
do its
found.
roles.
The body, once you get that body working, it knows what it has to do,
Yeah.
and it just makes it happen.
Yeah. So essentially you're saying it fits right into chiropractic care.
Absolutely.
Cool. Do you find it sells itself to the person?
Yeah, absolutely.
Once they've experienced it.
Absolutely.
Yeah.
It's a no-brainer. It's the technology. It has a technology that people do not understand and cannot do themselves. So the technology is what sells it to people. And
What do you mean understanding the technology? Because
And the-
it
what-
would
what-
blow, the technology would
the
blow my mind.
technology is
their experience of-
no, the technology of what it's able to do in a short, what it's able to
yeah.
make the muscle do in a short period of time that you physiologically cannot do yourself in that amount of time.
Yeah. Sounds like the benefits,
The benefits
that they
of it.
experience.
And so therefore, so if people are getting stimulated 25,000 times a session, then in 15 to 22 minutes, depending on the program that they're on, that stimulation, you can't do that naturally without the chair.
No.
The chair will do it. So therefore the technology is enabling people to maximise their strength in a very short period of time. And it's helping people in connection and it's allowing them to function better.
So let's touch on the programs. You've mentioned programs a few times. There's manual settings that can be we can change coil position. We can manually change frequencies from anywhere from 5 hertz to 50 hertz.
Yes.
But there's also programs.
Yes.
Which I think make it really easy in a day-to-day practice to, and they're based on the research, acute back pain, chronic back pain, sciatica, that kind of scenario, and just good sports resilience programs, all based on evolving research. Do you find the programs handy in your day-to-day?
Yes, the programs are very good to start with. When I first got the pelvic power chair, because I didn't understand the frequencies so much, it was a really good way to know that people were getting the right frequencies, and it was easy to apply. As time's worked by, I'm now understanding it more and more, but I think that just takes time.
You can kind of rely on the fact that there's some thought gone onto it.
But there's a wonderful new program that we've got on our chair now that's called Hypersensitive, and that program is phenomenal in the sense that for a lot of people there's a disconnect to where they're completely reversed in the way they use their muscles, and a lot of people have had this is my experience of it, so I hope it's correct, a lot of people that have had a history of very, very, very painful periods through the years. But then also I'm looking after a lot of neurodiverse people who suffer very, very high anxiety to the point that now some of them, they're then having some continence issues as well. But as a starting point to have them feel confident on the chair and not be frightened or anything, because there is a little bit of a noise, they can sit on it and you can just see their whole bodies completely relax very, very quickly.
Yeah.
And so that is another target of a way to help there's a lot more neurodiverse people and with high anxiety. So it's a really nice way just to kind of help them to calm down too.
So let's delve into that. I have colleagues that do understand, and some don't understand so much, that magnetic stimulation can be used in a variety of ways. And so do you find that when you have a patient with a presentation of anxiety, that often their pelvic floor would be more highly toned? We know that the pelvic floor is a threatometer and is fueled by the sympathetic nervous system in that way. Do you find that it's particularly useful for calming down tone when it's high?
Yes. Well, from a chiropractic perspective, first of all, I looked at it that the diaphragm was over-facilitated. And then, so I was always trying to help these people to breathe properly and to calm down and do their adjustments. And then when I learned about pelvic power and realised the pelvic floor and the diaphragm work directly together, then of course if the diaphragm's too tight, the pelvic floor's also too tight. So it could be that the reason why it's too tight is because of that too tight pelvic floor. So therefore, by having the pelvic power, it tones it down because it has programs specifically designed that they've heavily researched in Austria on how to tone down the pelvic floor. And that's just, and you can tell someone, desensitize, you can tell someone you must relax, you must breathe, and they can't.
It's like target fixation. I'm trying to relax, so I'm more tense.
And we've had,
this is frustrating.
Yes, exactly. And some people have, they can't. They've had different treatment. They've had Botox treatment. They've had different things to try to tone down the floor, but you need the programs to tone it down.
Yeah. At the end of the day, the genital and pelvic floor region is richly innervated with sympathetic supply, as it would need to be. You'd need a good amount of tone in your pelvic floor in an emergency. You want a good core to run away or fight off.
Exactly.
Thankfully, it's also richly innervated with parasympathetic nerve fibres, which are still there and that are nicely getting stimulated with those frequencies that we see people just kind of, after a while, even at higher intensities and whatever age, they're zoned out. They're quite parasympathetically stimulated.
Well, that's where some people like it just for that. They go, it's I just can feel myself relax.
Yeah. The more I've used it, the more I've experienced over a decade of people's responses, the more I understand how much more is going on than just giving somebody a strong pelvic floor.
It's so much more.
A strong pelvic floor, which we know can be weak because it's fatigued from constant tension, or could be lazy, and it would test relatively similar. They would lack endurance, but if you take their big picture and how anxious they are, what history of what they've gone through in their life that may have made it have a high tone responsive agenda. So I'm glad to hear that you have that experience of helping to optimize the function of the pelvic floor, which is optimal ability to be on, nice resting tone, and ability to release as well. So it's not a no-no to be using for people with high tone, but it should be used intelligently and with clinical reasoning.
Exactly.
But because you've got all those settings and programs, it's quite easy to apply good clinical reasoning.
Absolutely, very much so.
Yeah. So aside from all of the benefits to your clients that you've explained and you experience on the day-to-day, let's talk about business. Do you think it has been a smart business move to integrate this tool into your clinic?
Yes, it has. For our clinic, it's increased revenue to our clinic, and it's steady, and we can see the potential of it growing, and it's just steadily growing and growing and growing all the time. And people, and my ideal is to get it to where people work their way through the programs, because Pelvic Power recommends programs for people. So have people.
It's not a one-off treatment.
It's not a one-off treatment. It's a commitment to.
It's a strengthening process,
program.
but with all those other benefits that you can't achieve from
Absolutely.
just strengthening. But yeah.
So we get people through the program, help them, support them through the program, and then let them know that the chair's available if they should want it. So we slowly, now that we've been there a couple of years, we're slowly starting to see those people just regularly book in, and they regularly have their visits, plus the people that I'm taking through on a course of care. And then when I reflect back, there's a lot of people that have actually used it through the last couple of years that are just running better.
Running?
You know,
you mean running?
Or just their body's functioning better.
Yeah,
they're just functioning better, and then a lot over this past winter, there's been lots of viruses, and they've said, you know, normally when I get coughs, my continence is probably not so good, but this winter it was quite good. You know,
they realise later, because not everyone's got a cough at the time.
Yeah, exactly, and they realise different things have been better. So from a revenue perspective, it's definitely been better. It's created a new energy to our clinic. The Pelvic Power does have a draw on the electricity, but it hasn't been a massive draw on the electricity.
No,
it hasn't been a massive draw.
It's not three-phase.
and it's not a big stress on our staff. So it's been something that we've just integrated.
You had that staffing infrastructure. And
we had it anyway, so we were lucky.
You had a space, didn't you?
Yes.
And you have a special space that you had, a room. But interestingly enough, Pelvic Power is non-invasive. It is essentially built like a big piece of gym equipment, and it can be used in a relatively not public, not the waiting room, but certainly in a gym setting or a rehab area setting as well. So there's options, right? There's pros and cons, but I think people feel quite comfortable on it in the open, but it's nice to have it in a room as well. But it just
because at your clinic you have it where people can be on the biofeedback or on the Pelvic Power at the same time.
Correct.
Whereas people quite like their own room at our clinic.
Right.
And so we've kind of found when it's their time, it's their time. So at first I thought we could utilise two things at once, but so far that hasn't been the case. Sure. People quite like their own room.
Yeah, I think there's different strokes for different folks and different personalities, and we know those as well, and we will time it. But other people don't give a flying care.
I think they probably wouldn't care.
No.
The same.
Yeah.
Yeah.
I kind of know the history of some complex histories that we deal with of where people are at. So you use both parts of Pelvic Power. Pelvic Power, there is a biofeedback trainer, which is essentially a non-invasive option of assessing somebody's pelvic floor from the perspective that they can see right in front of their eyes what their pelvic floor is doing when they contract and relax. And tell me about that.
So the two pieces, as you mentioned, the Pelvic Power that we've been talking about is passive training, which is magnetic stimulation, where the person passively sits on it and their pelvic floor is stimulated through electromagnetic stimulation, to the brain. The biofeedback is active training. So the biofeedback enables people to sit on it and see what it looks like on a screen if their pelvic floor is working based on the sensor that's in the seat.
Yes.
So, and at first I didn't think this would be something that was so necessary, but the more I've used it, I've found that this is very important, because once the brain's been stimulated by sitting on the Pelvic Power chair and it knows the pelvic floor is there, the brain then now needs to be able to control it and know how to use it properly. And so the two pieces of equipment work well together.
They complement each other.
And also for people when they're undergoing a course of care, when they're paying for their care, they also want to know that it's made a difference, because when you passively sit on the chair, you know that you're getting stronger based on the intensity increasing.
Seeing is believing.
And you know that some of your symptoms are better, but in some cases, to begin with, people don't notice a change in symptoms because it does take a few sessions to get that muscle really starting to work. And so therefore, the biofeedback trainer is a way to show them that yes, you are improving, because when you did this the first time, you couldn't do this, and now you can do it a lot better.
Yeah. So do you find it helps with patient compliance?
Absolutely. Well, absolutely. Because when I take people through a course of care, first of all, when I do the trial, they sit on the chair for 5 minutes, and then they sit back on the biofeedback, and they've already improved.
Yeah.
And so therefore, that's a real good selling point right there for people to see that it does make a difference. And then when I take them through so many sessions on the pelvic power chair, then we do a biofeedback and check. And I say to them, based on what you had told me, is that people want to be around 50%, and then that shows that they've got a basic control of what they're doing.
Yeah.
And if they're at 50%, I feel confident that they're knowing they can take it from there. But for some people, they're not at 50. So they can see they're not at 50. So I go, okay, you're still not at 50. They already know about how many sessions it should take to get right. So in their head, they know what it is, but they're seeing that they're improving, but they're not there yet.
Yeah.
So it's just a really nice way that's not taking the mickey.
Carrying people through.
Taking them through, but kind of showing them with some kind of good evidence that this is how you use the muscle and this is how it should be. And I'm a classic example, because I was the worst of just about anyone, even though I didn't have any incontinence issues, but I still didn't have good control. And as time's gone by, I'm now one of the better ones, because I've worked on it. So therefore, I can say to people, if you work on this, you'll get better, and it does take time, but it will improve, because I saw that in myself.
Yeah. I find that it is particularly empowering, because if somebody is finding it difficult to release and relax their pelvic floor, and after a session they can see, oh, it just turns off much better.
Yes.
And it's empowering because they can literally see it. They don't have to believe me.
Yes.
It's right in front of their eyes. And likewise, if they've got much better endurance, they're just able to hold a lot longer. That does help with their compliance and continuing to go through their rehab program and continuing to do their own exercises, because they can see the value objectively.
People can see it. It's so powerful. And a lot of people these days like information. And it's informative, because there's their number, they can feel it on the chair, they can see what it looks like. And so it's really good for them to do that.
So there's value in each piece. There's definite value for just magnetic stimulation. And there's value from just biofeedback. Working together, it's a particularly powerful package, we find.
But for people who have had a hip replacement, say, or people who are pregnant, they can't go in the pelvic power chair.
It absolutely gives an option to
But this is a way
pregnancy,
to also, as a additional service at your clinic, that you can show them how to work, but also help support their back by showing them how to use the muscles.
Yeah. I find it particularly useful when you're trying to coordinate somebody's breathing with their pelvic floor activation. Most people would breathe in to lift their bits, and they're lifting all of their rib bits too. And so just locking in a better pattern of breathing recruitment and managing abdominal pressure with pelvic floor recruitment and core stability is gold.
But it's that active training where people need that, because at first I didn't think it was so important, and then I was like, no, it's so important.
I can tell you, Dr. Shelley, that I can spend 20 minutes explaining the benefits of breathing. They get it. They can see that, yes, it would be more efficient to breathe out while I was recruiting my core. And then you get them and test them, and they're like doing the opposite. They're like, see, it's hard being right all the time.
Yeah, no, you're right. And they go, doesn't it feel kind of back to front to you? No.
They go, it feels backwards, but it'll feel better when you got it right.
Yeah, very much so.
No, thanks for explaining what you experienced that as well. It's something we see every day.
Yeah, good.
So we've talked about pelvic floors, we've talked about functional magnetic stimulation from the brain down to the pelvic floor back up to the nervous system. What's the one big thing you would like to describe about pelvic power?
For me, pelvic power, not only is it strengthening the pelvic floor, but it stimulates the brain. So from a chiropractic perspective, we want to get the brain working the best it can, and pelvic power is a tool for that. And so from a chiropractic perspective, at our clinic, we love it. It's great.
Great, awesome. Well, thank you very much, Dr. Shelley, Cheyne, Chiropractor. It has been fascinating. I know we love talking about this stuff, but thank you so much for your time and your expertise of your experience over the last 2 years, adding to what you already were amazing with in your chiropractic care. Yeah, so I'm sure there's other chiropractors out there that will love to hear your experience. And
do feel free to contact me too.
Great,
If people
yeah.
have any questions or concerns, I can talk about Pelvic Power all day long.
Of course, I'm biased.
Yeah, exactly.
But yeah, no, thank you very much.
Thank you for the opportunity.
No, it's a pleasure. So yeah, we will certainly put people on to be able to talk to you about any questions they have from a chiropractic perspective, because I've got a physio brain. I'm learning more about chiropractic, but yeah, and vice versa. So thank you very much for your time.
Thank you.
Awesome.